Doctors play what's often called the dead baby card. Oh, you've got to do this, otherwise the baby's going to die.
Catherine Roseboom is helping women navigate pregnancy, birth, and postpartum from a place of empowerment.
I kind of almost feel like really let down by modern society, where it's taken us away from something that is natural and biological and made it seem like something so scary. I always think of that scene in Handmaid's Tale where she gives birth like completely on her own in a barn, and I'm like, yeah, you fucking go, girl. That moment of transition, which will take you to the point where you're like, I'm gonna die, like my body can't do this, I'm splitting in half, to come out the other side and you'd be like, okay, I've basically danced with death and I'm here and I have a baby. Let women realize how frigging powerful and magical they are.
What kind of birth do you dream of supporting more women through?
One where all 5 Spice Girls are there with me, like that would be really cool. The kind of birth I dream of supporting women through is one where they find their power and they say afterwards, oh my God, I was allowed to be myself and I felt everything through that. I believe you, I'm magic. That for me is incredible, and that's the power that every single woman has and should have.
Welcome to Do Not Disturb, the inside story. I'm your host, Simona Devta. One thing you wish every pregnant woman knew.
Physiologically, what is happening to them during pregnancy, during labor, not only physically what's happening, but hormonally, emotionally, kind of letting them lean into it rather than try and work against it. Every time I speak to someone pregnant, first of all, I want them to know that they're fucking magical and that they are the most powerful that they will ever be in their lives. But I wish that they would understand what's happening so that they can then have the experience that they want to have.
Epidural or no epidural?
Completely depends on what you want and what you need and what your birth plan is and what your main concerns are. It is completely up to the woman, but I will always say that you need to understand the pros and the cons. You need to ensure at all times that you are understanding the risks and the benefits and that you are making the decision for yourself at that time that is right for you. But I would never berate anyone for having an epidural. They are beautiful and they are often so great in letting someone mellow and just have that little bit of respite if they really need it. And I'm sure we'll come into it later, but there's so much that goes on that leads to them that might not be within your birth plan or your ideal. And I think that the body has an incredible way of natural pain relief if we just allow it. So I would always suggest learning other tools in the kit as well.
Best book for birth prep?
Depends how hippie you want to go. There's a lot of hippie books out there. There's a lot of really good sciencey books out there. There's also a lot of obstetrician-led books out there. It depends on what kind of birth you're thinking of having and what kind of person you are. But I absolutely love Rachel Reed. I love Reclaiming Childbirth as a Rite of Passage. I bought them here.
Oh, amazing.
I know, I've got props. Look at me. Reclaiming Childbirth as a Rite of Passage, I absolutely love. And this is my second copy because the first one got really dogged. It's fantastic. And I think there's a real notion that thinking about birth in that way can be really hippie. I don't think it is. I think it is fully, truly understanding like a woman's power and kind of taking it back to understanding that power and letting that moment happen where you turn from, a maiden to a mother and understanding that transformation. So I love that. I also love Expecting Better, which Sunshine debunks a lot of myths about what's happening in our medical arena in reference to a lot of the recommendations for childbirth and looks at those and evaluates them based on the actual evidence and what it shows, so that people can make the right decisions for them, rather than with the tinted spectacles on of being in like a doctor-led facility. And then like the guru, Ina May. You've just got to have Ina May's Guide to Childbirth. It's so useful in understanding the biology, what happens, how the body does what it does, and it's great for me to read as a doula, but it's also great for every single woman to read to understand what's happening to them. So those are my 3.
Amazing. I read only the third one, so I'm reading Ina May's book, Spiritual Midwives, at the moment. I read it in my last pregnancy as well.
Amazing.
But everyone I recommend to read it, they have, I think, quite not negative, but they don't, this is too hippie, this is too much, women giving birth on the farm. So I feel like middle ground books are better for women to access, because they don't want to feel like they're in an Amish society or being exiled in their they
it's
just
so
want
hard.
to feel empowered.
So. And I think it's hard, and I know we'll probably talk about this later, but that notion of how we all as a community perceive childbirth now is, I kind of almost feel like really let down by modern society, where it's taken us away from something that is natural and biological and made it seem like something so scary. And you don't want to be hippie, you don't want to be in touch with your body, you don't want to be in touch with like another realm of spirituality. I think if you can't do that in childbirth, when else can you do that? Like, I mean, apart from like, taking drugs, when can you tap into like that moment of like pure, like primal instinct? It's insane.
I'm not a drug user, but I have been present at some drug ceremonies of my friends. And when I did give birth to my child, I thought, oh my God, I'm definitely tripping. It is definitely a very psychedelic experience, and your body drugs you up with natural hormones.
You've got like natural opiates flowing around. So I mean, when you let the body do what it's supposed to be doing, naturally you're getting beta endorphins, which is phenomenal. Your body naturally makes that, and you kind of go into this, a lot of women call it like labor land, or it's called like a luminality, like that space of like being in another world. And some people even like see some of their ancestors, or they draw from wisdom from other women in their past life, and I mean not their past life, but who have been there previously. And so it is noted anecdotally to be a very powerful spiritual thing, but I know this goes probably a bit too hippy dippy for some people, and that's fine.
Welcome to Do Not Disturb.
Thank you. Thanks so much for having me. It's really lovely. I love the fact that you had the quiet power of childbirth. Like, it's a secret no one knows.
Well, I shared with you before, we texted a lot. I definitely feel like I had my child in 20s, and now I'm having another one 10 years later. And in between this time, there have been a lot of people having children in my circle. And I was so discouraged and so sad not to see my friends having the same experience as I had, which was a very positive experience. Actually, I think part of me wanting a second child was to experience the birth again.
To get that high
Children
again.
can come with... Children are not always like amazing, but the childbirth was fantastic for me. And I'm just like and now, since I'm older and I heard more stories and I've been exposed more, I feel like, am I the weird one? Like, that fear starts living inside you, because you almost never hear positive.
Do you find that you've changed your outlook on birth now after hearing people's stories from the other side, or are you still you're still clear in your head that this is something that you know and you trust in your body?
I hope so, but there is definitely now a doubt living in me. Whereas when I went into childbirth in my 20s, I was in university then, and I remember having equal pack of books of like childbirth books and then my university books, because I was very equipped with knowledge, and I went with this idea like that's the only way. I was very clear in my vision of having this perfect childbirth. Whereas now, after hearing so many different stories, I'm like, let's hope it's going to be the case. But
I think obviously
open-minded.
Knowing things that you can do to make that more likely is really good power to have. So like you say, you had a load of the books, done loads of research, you've had a positive birth before, and then kind of really leaning into that knowledge to help you make the right decisions along the way that will all contribute to a positive experience down the road.
Exactly. And one of the things I think that a woman wanting to have unnatural childbirth is a word that she learns that probably, I don't know, me as a non-pregnant woman, I didn't know what a doula was. I didn't know what is it. It's just not a word that you come across in the modern society very often. So can you tell us what is a doula and why? How did this happen? Because last time we spoke, we were talking all about condiments. So I'm very curious. Yeah.
So
Very cute. It was Green Goddess that
we were discussing a lot of salad dressings and mayos and things. So a doula quite literally translates as a slave. That's not what I am, but it is really someone who is there for the mother. You are there to support them. I won't ever say help them find their power. They have that within them. But be there to kind of illuminate where they can find their power, present a woman with options so that they understand and have all that knowledge at their fingertips to make the right decision for them at the time. Also to support the birth partner. Often the husband or the partner feels very left out of the loop and very helpless. So it's supporting them through what can be a very challenging emotional time. I, obviously with a food background, I also make sure that I nourish the pregnant woman and postpartum as well. So there's a lot of that. There's a lot of picking up laundry, cleaning the house, like basically being an extra pair of hands to really support the woman. And essentially, I, as a doula, I'm the village. It's the village back again that we have completely lost by living so far away from our families or going into hospitals to have children and really losing that wisdom, that knowledge that should be passed down from generation to generation. And that's what a doula brings back. We're not medical. So we don't get involved or make recommendations. We give all the information to the woman, to the family, and they can decide what they want to do and which path they want to take. And at all births that I have been at, there's always a midwife there as well who takes that more medical perspective and frees them up to do what they need to do. Midwife services are so pressed. So having a doula there to look after the mental well-being of the mother and be that continuity of care is a really big deal. I think I've got there was a study done about continuity of care. It was the Cochrane Review of 2016. And when there is someone who is with you throughout your antenatal period, through the birth and postnatally, you have a much more positive experience and also have less need for interventions as well. So it's a lot about kind of trusting the space you're in and feeling more secure, more safe, more confident. So that's what a doula is.
That's great. And what are the most common questions that pregnant women ask you?
A lot of them need help navigating. And most women come to bring on doula services for a second birth. They think that they knew a lot for their first labour. They've done NCT. They've read some books. They thought that, and this is not slating men and husbands anywhere, but they thought their husband would be sufficient birth partner to have. And they did what every pregnant woman in the UK does. They kind of set along a certain path and they don't end up having the birth that they expected or wanted. And there's a lot of hurt and upset from that. And I think then they reach out to kind of say, do you know what, actually, we need to strip this back. I know it's possible to have the birth that I want. I need you to help me navigate the system, understand my choices, make the right decisions for me and make sure that I have all that info at my fingertips. So that's generally what most women need.
Yeah, I have a very close friends. We're still close now. We live in different countries, but we had same due date. And I went into labor first. And clearly she called me. She was like, how was it? And I was like, it was amazing and like wonderful and radiating and all the positive things. And she goes into labor a week later and she calls me and she goes like, you fucking liar. Like, I cannot believe you set me up for such a failure. It was horrible, and like I teared and it hurt and like I hated everything. And she was so upset with me. She was like, you lied, like what a bitch, 2 years later she calls me and she's like, now I know.
Yeah. And the difference between that
second baby.
Yeah. And did she have a doula
and
with the
she
second?
had a doula to guide her.
I feel like as well, it makes a difference, like the luck of where you get, who you get on the labour ward that day, how quickly you go in, what's happening to you, you know, physiologically, who assesses you when you first go in, the language that they're using when you get admitted into hospital, all those kind of things, or even choosing to have it at hospital or home birth. There's so many elements that can impact not only the outcome and how it happens, but also your kind of mental agility throughout it and your reflection on it as to whether it was positive or negative. So there's a lot there to navigate. And for people who have never done it before, I mean, you wouldn't run a marathon without practicing or having someone give you some advice. So this is where, you know, your mother, your grandmother, the village elders, like everyone has knowledge of this, and you're continuing a path that your mother and female ancestors have all trodden.
And I think, unfortunately, at least my mother and her generation friends, they did not have a positive birth experience. And it was something to forget and, you know, just get over with and then be happy you had a healthy baby.
Yeah.
Yeah.
At least you got a happy baby, they say. At least you got a healthy baby. And you're like, but I'm traumatized. No, at least you had a healthy baby. Don't worry.
My mom had her children in Soviet Union, and I think that was just another level of, I think, abuse to women. You know, is that how it's called? Epistomy was done to almost every woman.
Yeah.
And then she would be given a mop to clean up after herself for units after having birth.
That's insane.
And it was really hard. So when I tell my mom I can't wait for my childbirth, she just thinks, I don't know what she thinks, but that just doesn't resonate with her. So we grow up in this culture, you know, and with a lot of information now and a lot of options. In the UK, more than any other country I lived in, you know, we have home births, we have birthing centers, we have hospitals, obviously, and we have cesarean, which is an incredible surgery that saves lives, you know, and minimizes certain risks. But I looked at some statistics. I live in Brazil at the moment. I share that with my audience. 80% of women privately, but most women in Brazil do go private, have a cesarean birth. We have like 30% now in the UK, well over 30% in the UK, and these numbers are growing. And that's a surgery that was supposed to be like
just for life saving.
Exactly. And it's a major surgery. And I know most women, at least in my circles, they say, I'm going for cesarean, like without even considering other options. Why?
It's a massively loaded question. Why? Like you say, it's a life-saving surgery, and quite often there are multiple interventions prior to an emergency cesarean that lead to that being the only option. That was the case for my birth and a lot of the births that my friends had. I gave birth at Chelsea and Westminster Hospital in London in lockdown. And I think out of my kind of antenatal group, I think 75% of us had emergency cesarean. So it's huge, and it none of us wanted it, none of us expected it, none of us had elective cesareans. But the cascade of interventions, often done just to be safe, to get that healthy baby.
Can you tell us what are these interventions? So maybe some people, is it like...
It could be absolutely anything from when you go into hospital and you believe that you are in established labour, and you will get triaged and checked, and a midwife will say, oh, you're only 5 centimetres dilated. You will be deflated. You will be upset. By that point, your contractions may slow and they may halt, and you may be at 5 centimetres for a long time because you're in a hospital. You're not in that safe, cozy place where the oxytocin can thrive and you can start to labour again naturally, because oxytocin is what helps our uteruses contract. And so it could be the basics and beginning of that, and then you are not progressing in the way that you should be. So a lot of NHS trusts use something called Friedman's curve, which is a kind of an expected timeline of how you should dilate and labour over the period in hospital. And there's certain issues with that timeline because it was done a long time ago. It was done in a hospital setting and it was done to heavily sedated patients, apparently. So there's a lot of issues with it now, then transferring it to modern culture, that then you're set against these parameters that may not fit who you are as an individual and your own personal journey. But because a hospital has to have limits, they have to have rules and regulations, because otherwise, you know, they have to manage the amount of people going in and the time that they're using people and the staffing costs involved with using people. So there's a lot that happens, and the output of that is that the pregnant woman is often at the mercy of those limitations. And that goes the same with naming women high risk or low risk, down to age, BMI, etc., etc. And those things change from NHS trust to NHS trust, which is also really hard to navigate. So you might be high risk in one trust and then go to another trust and your blood sugars will be okay, so you won't be high risk. So there's a huge amount there that is not a problem, but it is there to safeguard, you know, it's there to safeguard the hospital, and it has to be, those decisions have to be made with the greater good in mind. So I will never berate the medical professionals for doing these, but it doesn't take into account the individual.
Overall, over decades, childbirth death has decreased dramatically.
It has,
right?
Yeah.
So all these interventions were designed for a reason.
Yeah.
Just
But
the problem now, as usual, we lost something. You know, so now we need to
readjust. So let's say someone goes in and their labour stalls, and then the doctor will say, well, do you know what, let's put you on the oxytocin drip, let's put you on the IV to induce you and get your contractions going again. That's another intervention. What you're then doing is giving the body synthetic oxytocin, which doesn't have all the benefits of your naturally produced oxytocin. So you're not getting those beta endorphins, and you're not getting the natural pain relief. So then you say, oh, actually, I'm going to have an epidural because it's hurting too much. The contractions are coming too close together and it's hurting too much. I want to have the epidural. Epidural may then slow down your labour even more. You're not as in tune with your body anymore. You're not able to move as freely to help the baby and help all of those mechanics of labour continue on their journey. And then an obstetrician may come into the room, turn on the lights, so you know you're not in your safe cozy space anymore, and then go, do you know what, it's taking too long, you're just not dilating quick enough, baby's getting distressed, and we're going to have to take you in for an emergency C-section. And I mean, that is very
right mind is going to argue with the doctor at that point.
No, well, you're also not, when you're in labour, you're not kind of working with your prefrontal cortex. You should be in a very primal state. So someone then comes to you talking about, you know, signing a C-section form and giving, you know, your consent to having this huge operation. And you're then, hang on, I'm supposed to be in labour, I'm supposed to be cozy, I'm supposed to be in another land, but now I've got to sign some paperwork. And you're kind of working against something that is so naturally ingrained in us to happen safely and efficiently, that it's a cause and effect thing. So that is why there's a lot of C-sections happening. It's also, there's a point I know you mentioned in Brazil, it's a rate of about 85% in private hospitals. I know that like in some countries, obstetrics, they do tend to get paid for their service provided, not the hours that they work. So it makes sense to do a quick and easy C-section rather than a really long vaginal birth.
She asked me, when would you like to give birth? And I said, whenever the baby comes.
Yeah, when she's cooked.
And she looked at me like, are you crazy? Mm-hmm. Like, you know, the vibes she gave me. I had to change 3 or 4 doctors until I was not met with that kind of like, what kind of animal are you? So it felt, I think if it was my first child, probably I would be like, okay then, you know.
That's just how we do it now,
but,
yeah. And I think that's the thing as well. So a lot of people are scheduling in the birth because it's convenient. Well, you know, I'm going to do it then because that makes sense, because my husband's going to go away for his paternity leave then, and I can count down. Okay, yeah, if I have it then he'll have 2 weeks, then that will happen, then that'll happen. And that's convenient, right? But then there's also the fact that it's seen as, too posh to push, and it's the easy option. I'm going to tell you, C-sections are not easy.
I was going to say, I bet the recovery is very different. We have a guest who shared her experience. She has 3 children, and only the third one came naturally because they didn't make in time for the hospital for anything else to happen. And she said, oh my God, why nobody told me I would be like cooking dinner or going out with friends the next day? My body felt so good after. Whereas after C-section or even epidural, you can tell us in a more scientific way, but I also saw the recovery of my friends is very different, and they're in epidural, they're usually heavier tears, tears, and things like that. So
I think what's incredible and that is often forgotten is the body's ability to labour and do things itself. And it's that understanding that a lot of women don't know, and I don't think midwives have time to explain. But the fact that, for example, you give birth naturally, and as the baby comes through the vaginal canal, they have a surge of adrenaline and cortisol, and all of that helps prepare their lungs and their heart and their brain for life outside of the womb. It also helps clear their airways as well as they're coming through. You also get the added benefit of the gut flora coming out. Often the mother will defecate at this point of pushing. The baby faces backwards as they come out, so they're getting a lot of that gut microbiome, so their first load of their immune system. But not only that, baby comes out straight on skin, that oxytocin rush, and I will call it a rush, that helps contract your cervix to help the placenta pull away naturally and without hemorrhaging. Whereas a lot of places will pull it away, get it going before it's ready, oxytocin and, injection to get it going. We have everything inbuilt to do this naturally and for the body to do it well. And understanding that, I think, makes a big difference to how women view labour and that element. And I often liken it, and this is a really horrible thing to say, but your body knows how to shit. Your body knows, like, when you're going to vomit, and you just give in. You're like, yep, okay, fine, I know what it's doing. I'm going to leave my body to it. Your body knows how to labour, and completely agree that in cases we do need support and there does need to be interventions. But if you left a woman, I always think of that scene in Handmaid's Tale where she gives birth like completely on her own in a barn, and I'm like, yeah, you fucking go, girl. But taking it to an extreme.
Me, for example, I am going to probably have a midwife. I'm actually meeting her tomorrow, but people are very touchy in Brazil and like very warm and nice, which is great. But me in my childbirth, I want to be left alone. I feel like my body knows, like, I want to be that girl in the barn. I really felt the best when I wasn't told when to push or when not to push, or like I just needed to. I was almost sleeping. So I remember
labor land
Samuel. And my partner was like, I'm exhausted. You slept through the whole thing. I was awake. He was like, you were just sleeping the whole way. But really, I was, not that I was resting.
No, I know. But between contractions, you kind of go off into this other place. You find that strength from within you. And it's a natural way of being able to cope with the length of time, the stamina, the hormone shift, the pain. I know some people don't like to use the word. And
people would be rubbing me and telling me, go, or don't go, or I would definitely not be in that place. So,
but equally, some people do need that. And, there's one of my clients really wanted a big buzz around her. And actually, when her kids came home from school, that's when her labour started really progressing, because there was noise. She was used to it. It felt comforting. So I think it does completely depend, but you will know what's right for you in that moment and how you want to labour. And going back to the notion of hospitals, I know it's very easy to, home births are best, but if hospital is where you feel the safest, then that is the place for you to labour and to give birth. And that is so powerful to know that. There's absolutely nothing wrong with giving birth in a hospital at all. So I think, like you said at the beginning, knowledge is power. Understanding actually what's happening and all your options, then you can make the right choice for you.
Yeah, and C-section could be the right choice, but I think it's also understanding. So you mentioned adrenaline and oxytocin and like all the things, the gut bacteria that the child gets, the immunity. Does that mean the child does not get all of these things if you go through C-section, gets less of those things?
Yes. Yeah. I mean, look, every woman who has had a child by C-section and who has had a healthy child from C-section knows that you still get a beautiful, wonderful, healthy baby. There's no way of knowing, because you can't check with one baby what way would have been, how they would have been different if it had been a vaginal delivery versus an abdominal delivery. So you'll never know one way or the other. But yes, there are a lot of physiological changes that are very, very welcomed when you have a vaginal delivery versus if you have a C-section. However, there's a lot more trusts in the UK particularly, and private hospitals in the UK are actually doing something called gentle cesareans now, where the incision is made and the baby can acclimatize themselves to the outside world. So they actually can, babies when they're born can crawl. And they can crawl, it's a little bit like Alien, I'm not going to lie, but they can crawl out of the abdomen, and they will often find their way to crawl up to the mother's chest. It is freaky, but isn't that such a nice, like, peaceful way?
To boobs, but this is, I mean, it's great, but it's just...
Yeah, but knowing that you've got that option, I mean, if I had to, go in for a C-section, then I would say, let's do it as calmly as possible. You can have lower lighting, you can have music playing, what's great is that when you've got, the spinal tap in or your epidural in, that anaesthetist can put in whatever you want, whatever cocktail you need. I remember saying to my anaesthetist, I was like, I'm feeling so anxious and shaky. And whether he did something or not, or it was a placebo, he was like, okay, I'll give you something for that. And then immediately I felt a bit calmer. So whether he'd put some kind of something in.
I think that's the thing. We shouldn't demonize any of the things, because I'm like super hippie and everything. But at the same time, I'm trying to prepare myself. There might need to be, an intervention. And I need to feel like as long as there's a happy baby in the end, all options are good and we are here to use them. That's what the modern society is for. So...
But it's making sure
all
that
of them are evolving.
Yeah, know the options, know the risks, and that you've made that decision, not just because a doctor's played like what's often called the dead baby card. Oh, you've got to do this, otherwise the baby's going to die. I'm saying, hang on a minute. What is the research? I need to just look at the pros and the cons and what the research says. And being able to navigate that, I think, is really important. But it's also hard if that's happening when you're in labour and you want to just be in your bubble. So that's where a birth partner, a doula, can really come in handy, because they can really kind of advocate for you.
I'm really hoping to bring one, because I know my partner is a different partner than the one who was present at the first birth, and he's very medical and pro-hospital and kind of on the others. If it was his choice, it would be a cesarean, but he's very respectful of my choice, which is nice. But I know if it comes to this question, when the doctor is there, he will be with the doctor on this. So I'm like, I need to bring someone who will be able to assess situation without being emotionally involved, but at the same time equipped with knowledge to make the best decision for me and the baby, right?
So and I think that's so important. Like you say, that the kind of white coat syndrome, someone comes in with a white coat, you believe they are the expert, but you are the expert in your body. So making sure that you know what's happening in your body and why, and what all the risks and the pros and cons to whatever they're suggesting are, is good. But I completely understand what you're saying about your partner. I know that my husband would be exactly the same, because ultimately his main concern is you. And if a doctor is saying this needs to happen or there is a risk, that word risk, like even if it's like a 0.00001%, hearing that word, he'll be like, I don't want to risk you. I fucking love you too much. I'm not doing that. So yeah, it's a hard line for them, and that's why I really feel for birth partners.
Thanks for joining us today. If you want to hear from more inspiring voices like Catherine's, follow Do Not Disturb and share this episode. It helps us reach more women who need these conversations. And I think even if we take out the cesarean, like my water broke at home, and when I arrived when I arrived to the hospital, I felt like I'm really in the active stages of labor, but I don't remember exactly, but I wasn't dilated enough, and they were like, you're young, it's your first baby, it's gonna take ages, go home, come back later. And I was like, I'm staying, I feel my body, I'm going to give birth. I gave birth in 40 minutes from that point.
I love you so
And
much.
if I wasn't trusting myself, I would have given birth in an Uber or I don't know, a bus or God knows what. But like I was like, I know what this is.
And teaching women to know what to feel for. So like if someone says to you like what you'll feel before you vomit, and then giving into that, it's like teaching a woman, okay, what you will feel at different stages of labor. Where would you feel pressure? What do you instinctively need to do? What will you be thinking about? That will help you know, without sticking fingers up yourself to find out how many centimeters dilated. You will get an idea of where you are on that journey. But some women want that reassurance. They want to know numbers. And again, it's knowing all your options. That's what I'll really say.
How can we learn those things?
I can help. But I would also say reading some books, listening to podcasts or audiobooks. I think you can also ask your midwives or your doctors as well. They are legally obligated to provide you with studies and with evidence for anything that they're suggesting. And then you can go away and you can read that and you can say, actually, do you know what? I read the study. You were recommending that because my BMI is 1 over normal, you've put me in a high risk case. I've done some research on it, but actually I still want to go for a home birth, for example. Having that knowledge and reading those papers makes a big difference. So yeah, it's all about knowledge.
What other mental preparations can a woman do to feel more grounded? So other than reading, do you recommend attending NCT classes? Is that something you would say a hidden thing to do?
It's a really difficult one because I think that, so I did a type of NCT class. The content in the classes that I went to centered around, these are your pain relief options. There was nothing about the biology. There was absolutely nothing in there about any hormones. It was all about what do you pack in your hospital bag and, how many centimeters dilated do you need to be to start pushing and those kind of things. However, having the support of a group of women going through what I was going through has been invaluable. And, we were all texting at all hours of the night. Has anyone else had this? Who's had this? What have they done? That support was incredible. And part of the reason why I became a doula, that is the reason. Just that power of women supporting each other is incredible. So I would still do the research. If you really want to have the full knowledge, I would read the books. Yes, it's good to understand pain relief, but I mean, there's other tools as well other than just, gas and air and then going on to pethidine or having an epidural. Yes, you need to know it, but that shouldn't be how you're approaching birth and labor. In my view,
that you can use
exactly. It's a tool in the kit, and I think that some more holistic tools have been forgotten. The power of water has been known for centuries for women giving birth in water, for the pain relief that offers.
I gave birth in water, so
you're a man. It
was really good for the pain. They do call it midwives epidural, I think.
Yeah.
I used a shower and a bath and then shower again and a bath, and I moved a lot. But also I think everything comes out a bit cleaner. So
yeah, it's good. There's pros to it. But yeah, I mean that's a form of pain relief. There's also TENS machines, there's massage, there's movement, there's even, I loved dancing when I was in labour as well. So, you know, taking yourself away, obviously that's for early labour, less so for established labour. But there is a lot you can do, and actually even using the voice as well, moaning and kind of letting it out. For some women, those reverberations really help. So it's getting a toolkit together and working out what will work for you, because you might get into labour and be like, oh, do you know what, actually this is fine, where's my playlist? And you'd been all the way along the route of thinking I'm going to have an epidural, but actually you're like, no, let's stick some jams on and have a bit of a boogie. So it's knowing what you can have in your toolkit, what will help, what will
I had a
get things going.
birthing play on the background, and I think I watched a lot of, I don't remember which book this advice came from, but I watched a lot of mammals give birth videos on YouTube.
Mm-hmm.
And honestly, I was closer to a cow than a woman when I gave birth to my, it was very much primal animalistic experience. There was nothing human in me, but I think learning from the animals, because I learned from animals. I think those videos,
I mean, they go away and they find a safe, quiet spot and they go and they get on with it, don't they? So yeah, you can learn a lot. We are essentially mammals, and so much of what happens to us in labour is primal and is evolutionarily, and we're trying to retrofit that into a medical into a medical setting. And we
retrofit all aspects of our lives. So I feel like
a lot for women as well, you know. But we could go down like a really big feminist path another day.
But what's the role of men in particular? Because I think women and men are different, not in any negative way, but I think what's the role of men, and then what the role of partners in childbirth, and if they are different before the childbirth, during and after.
I think it's whatever you want them to be. You are the most important, but whatever they also need to be. So like my husband, he really wanted to just know I was safe. And he liked to learn about all of the science behind it. So that for him was really important. But I think if you want to go on the journey with that person, then understanding, doing all of your learnings together, visualizing and sharing your birth plan with them so that they can advocate for you if you are unable to. I found it very helpful. This is probably too much information to share, but sorry, Josh, if you're listening. My husband helped me with my perineal massages because I couldn't reach because my bump was so big. So that was very nice. And I practiced my hypnobirthing and breathing whilst he was doing that. So I wasn't thinking about what he was doing, because it's weird.
During labor?
No, before. Just so, from 37 weeks, I started oiling up my bits. And he did all of that for me because I couldn't get the dexterity in there. Do you know what I mean? So yeah, so that they have uses, and it's whatever you and they feel comfortable doing. I think it's not to be forgotten that, baby's half theirs, but if it is that partner, but your birth partner is really there to support you. And
do you recommend oiling? So I remember preparing my breasts for birth. I don't remember oiling my vagina, but maybe I should this time. So is that part?
You can do. I mean, NHS recommend it, but it is also a practice that has been going on for years. So in Thailand, they use coconut oil. I think in Victorian England, I think they used to use lard and butter. I think it's whatever slippery stuff is around, just to kind of help lubricate the area, and you get it used to kind of being a bit stretchier. But again, your body can do it without that. I think if you are in a setting where you're being told, push, you're more likely to probably tear. Whereas if you are moving with your body, and sometimes a lot of women will move position to stop labour a little bit just so that they can readjust and the perineum's not so stretched. You can also do that as well. So there's a lot that can be done without having to lube up your bits.
Yeah, in the book that I'm reading at the moment, which is in a May book, I'm rereading it again, and they ask always their patients to pant and slow down a little bit just before it comes out, so there is a little bit more control. I don't that part is kind of foggy in my memory from the first birth. What about after you had the baby? You said it's very important to put the baby chest on your chest,
Yeah.
for that oxytocin to flow.
Yeah.
On mom's chest or partner's chest can equally be good for the baby?
I would say that for 30 minutes to an hour after, well, as long as possible after birth or after labour, it is much more important to be on the mother's chest. It will help promote breastfeeding, bonding, but also, like I said, that oxytocin and the smell of the baby's head actually encourages oxytocin, and all of that helps the uterus to contract down, rid of the placenta, and also to shrink back down. So the longer you can be in that little kind of, they call it the golden hour, that oxytocin bubble, then the better. But there are a huge amount of studies that support the notion of skin to skin with fathers, but I would say not in that most crucial time.
And I don't know if I have the timelines right, but the baby is born, we put it on the chest, hopefully it somehow finds its way to the breast. Then we give birth to placenta holding the baby.
Yeah, you can do. That's called delayed cord clamping. So when the baby is born, some of the blood that will eventually circulate around their body is still in the placenta and in the umbilical cord. So there's a movement amongst healthcare professionals and doulas called wait for white. So you wait until all the blood has transferred from the placenta into the baby before cutting the cord. And that just ensures that they're getting the most blood that they can. And so I think that is quite important. Yeah. But then you will give birth to a placenta. You can have an oxytocin injection, which will cause contractions as well. That's often given if there's a risk of postpartum hemorrhage, but equally it can also cause postpartum hemorrhage. So again, it's knowing the risks, it's understanding what's happening biologically, and seeing the evidence.
Well, I was very lucky. I gave birth in NHS, and the midwife that was with me, supplied by the government, was a phenomenal lady. Her name was Natasha. I think you never forget.
I love that you remember her name. Yeah, mine was Jenny.
Accompany you. Yeah. She was absolutely phenomenal, and she gave me Samuel, and I think I was so young, and there was a very big denial in me that I actually got a child in the end of pregnancy. Like, these two things did not correlate with each other, and my contractions just came to a halt. Like, I stopped childbirth and my placenta wouldn't go out, and she said, just hold the baby, just sit in the bath, we'll change the water, and then she put me whilst holding the baby on like a little stool. And, and then it was a few pushes, but it came out. But I'm glad that she didn't say, oh, you did an injection, let's go, let's do. Like, she was like, just
give it a moment. Yeah.
Process the moment.
Yeah. It was probably your body just needing that time. And that's the amazing thing. Your body's pretty magic, and it will know that you needed that moment. And thank goodness you had that midwife, because like I said at the beginning, there's so much that can depend on who your healthcare provider is.
Yeah, and the first one, I don't remember her name. She was not as warm and nice. And then Natasha came, and I just remember my birth just activated from that point on. So I'm very careful now choosing who will be in that room. Many dads feel a little bit useless because, especially I think, seeing natural births and then breastfeeding, and they're like, well, what do I do, Yeah. What how do you recommend to prepare them better, and what can they do in the first 24 hours?
In the first 24 hours, they can hugely nourish the mother, but they can also be in that bubble. Like, they should be, that oxytocin bubble should include them if the woman wants them there, but that is really a moment for the family, and it can be a really crucial bonding time. And most of my clients say that moment is like the closest they've ever felt to their partner. So I think that knowing that you can make a difference, and that it's more of like, it may not be a practical thing that you're doing, but it's a very like spiritual bonding, intimate thing that you're doing, I think can be really good for both mother and father or partner. non-birthing
And
partner.
do we know if there is any evidence in changes in the baby's brain when they connect with the partners?
Yeah, there is. I mean, there's certainly lots in childhood as well. So children get a lot of different interactions with a father versus a mother, and children and fathers get their oxytocin through play, whereas children and mothers get their oxytocin together through closeness and bonding, which is really interesting. But in terms of what's happening to a baby when they bond with a dad earlier on, let's say they do skin to skin, every day they're doing skin to skin. Number one, oxytocin, great. Bonding is wonderful. But they also get more natural flora for their immune system because they're skin to skin with a different person other than mum, which is great. Get a cat involved there as well. Let them hug a dog as well. Get as much gut flora going on as you want. Babies also get an attachment system developing, making babies feel safe and secure when they have that additional carer, parent. They get more emotional regulation, and they also get more cognitive development because it's a slightly different interaction, a different person, so it's firing different bits of their brain. So there are a lot of benefits to having a lot of people. And again, this always comes back to the village, doesn't it? So yes, the father's great, but get everyone involved. The more people you can get involved, but making sure that time with mum is paramount because that's where the baby's been for 9 months. So that's where they're kind of getting all their good stuff as well.
Oh, I can't wait.
I'm so excited for you.
Can we talk a bit more about the postpartum reality? Like half of the guests of Do Not Disturb and almost all of my guests are moms because I feel like the reality of moms and other women are a little different realities. 6 weeks has come up a lot. So NHS guideline is 6 weeks recovery. Yep. And women are like, what? Like,
I think, is that coming from like the 6-week check that you're kind of like, you go and have your check and then, okay, bye, well done for having a baby, see you later, that kind of thing.
Well, they say you're safe to have sex again after 6 weeks. And then there was a guest who said, I just got over with it, at 6 weeks.
Yeah, I remember listening to that one. I mean, again, it's a bell curve, isn't it? So it's all based on a lot of data from a lot of women, and it's where it falls most naturally. So some women will be ready for sex a week later. That's why they try and push contraception on you because you're also at your most fertile when you've just given birth. But some women are up for that.
I'm like,
don't do it. But then, I know that it takes some women a lot longer and months, especially when you think about like the intimacy of, like men touching your breasts, which you might feel they are for my baby, they are not for you. So, and feeling like you want to regain control of your body, it can take a long time. And there's actually a lot of studies showing that in terms of recovery, different bits of you recover differently. So physically, you might be recovered within 6 weeks, emotionally, mentally, and then sexually can take up to, 5-6 years for you to kind of find your mojo again. So there's a huge amount of recovery, but I think we need to bear in mind that when we're talking to women about recovery, it will never, ever, ever be how it was. And women shouldn't keep trying to get back to how they were before. They are a transformed being after doing what they have done, and you will always be different. You will always be altered in some way, and it's finding out who you are then as a mother or in that new phase of your life. And not being afraid.
New words I learned was another guest called Zoe Blaski. Mamatrescence.
Yeah.
It's like adolescence, but I love that. It defined this for me because we don't expect to go back to the way we were when we were 6, right?
Exactly.
Like,
we
became adults and it's another version of that child.
Exactly.
And then there comes parenthood and that's another evolved.
Yeah, exactly. And so I think, 6 weeks, fine. If that's when your doctor wants to give you a checkup. I think a lot of checkups are not probably done in the best way. I mean, I had my daughter in lockdown, so my checkup was 5 minutes, and they just said, how do your stitches look, and are you okay? And I was like, don't know, just had a baby, is this how I'm supposed to feel? And then they were like, oh right, well your stitches look good, okay, off you go. Do you know? And that was it. There was no support at all. There's companies now offering something called a mummy MOT, which is incredible, and that's looking at your pelvic health, checking for diastasis recti, or making sure any adhesions are looked after, or how your pelvis is aligned, and helping support that get never back to how it was, but into a healthy way where you feel able to sneeze without wetting yourself, or get back to your daily activities again, or feel like your core is able to support you while you're holding your baby. So there's a lot that can be supported when you're getting back, and I think a lot of women forget that or take it for granted and try and like get into their skinny jeans again. And there's a lot as well to do with nutrition, and I guess that's my passion in the postpartum days, is making sure that women are nourished and not going out and having beer and sushi because I haven't been able to have it for 9 months. And it's like, okay, no, your body's been through something pretty serious. Let's nourish you. Stay relaxed, let the village bring you food, make sure that you're, getting all of that nourishment, those extra calories. It's something like 2,000 extra calories to nourish your postpartum body and also to support your breastfeeding journey. So there's a huge amount that needs to happen rather than just 6 weeks.
Some cultures call it the 4th trimester.
They do,
right?
yeah. And there's even hotels in the Far East as well. You can go to a 4th trimester hotel where it's just you and your baby in a room, or your partner as well, and you basically get waited on hand and foot. I mean, it costs a fortune, but it's that element of kind of lying in. And there's also another view of 7, 7 and 7. So 7 days in bed, 7 days on bed, 7 days around the bed, 7 days around the house, and kind of looking at it that way and gradually kind of extrapolating further outwards so that you kind of look after yourself in the right way. Don't try and kind of immediately go out for a run.
Definitely. What are a few things, maybe like few tips that you wish more women knew in those postpartum first weeks that they face that whole new life, And I feel like I have only one child, but 1, 2, 3 or 4, every time it's going to be a new life because you've never been a mom.
Exactly.
You've never been a mom of 3, right? So what advice would you have for those women?
Rest and connect with your new family. Don't be afraid to say no to people coming over, or if they do come over, put a sign on your door that says, this is where the tea lives, cook me a meal, put the empty cups in the dishwasher, don't give me more work to do. So be strong with what you want postpartum, and this kind of comes to the point that you were talking about before about what a dad can do to prepare as well. So as much as you're preparing for birth, try and prepare for the postpartum time as well. What do you want? Do you want people coming over all the time? Do you want people disturbing you? How do you want to be? Do you want to stay in bed? Do you want to stay around the house? So really kind of having an idea of how you want to manage those days. So I would say plan, prep food, get a doula. Ta-da! And I think those are all things for postpartum that I think it's really important to do. Yeah,
I think first one, I was very eager to go back to me, like you said, and it's a trap. It's like it's a way to fail. Whereas this time I'm like, I'm just gonna do nothing, like at least a few days. I don't know how long that will last, but definitely I will try to do as little as possible. And I use an application called Pregnancy Plus or something like that. It's free, where you see a baby, your baby's like a pineapple, your baby's like a banana. And it had a really funny exercise. So it said, take a circle and then make 24 like little pizza slices in it, and then color it in like 8 hours of sleep, 8 hours of active life, what your daily activities look like. And then each family member, so I got my 10-year-old to do that as well, and then do a new version, how that day changes when all the baby activities come in. And then divide the load based on that. And my son said, I'm happy to give him a bottle when you're like when you will be able to, because first 6 weeks I don't want to do that. I don't want to change nappies.
Yeah.
But it's like there is a big load that's gonna come in.
Yeah.
Right? And
That's
where
such
do
a
we
great
find the hours?
exercise. I love that.
I didn't know this one. Yeah,
That's
it was
a
a
really
fun
good
thing
one.
to do as a
Yeah.
family. And yeah, some closing questions.
Yeah.
What would it take for society to start viewing birth as a rite of passage? Again, I love this rite of passage. I know you brought it up in the beginning as well.
Yeah. Do you know, it's really funny because before I read Rachel Reed's book about reclaiming childbirth as a rite of passage, I had never thought about it as a rite of passage because of how society is now. But I remember when, and I had an emergency cesarean, but that moment when my daughter came out and cried, I uttered like a guttural, primal, like I don't know if it was a cry, a moan, or whatever it was. My husband said that he'd never heard me make that noise before. And so even in, a sterile C-section environment, it is transformative. And I think acknowledging that is a really vital step. I think that bringing back, for me, is about bringing back the village. And I think every rite of passage you think about, so in a wedding, you are around people who want to celebrate your love, baptism, you're around people who have been baptized. At a bar mitzvah, you are around members of the congregation who have done that before. So being around women and sharing that wisdom and that power and that knowledge, I think, is a way that we can reclaim it as a rite of passage, because we can say, do you know what? I'm part of that fold now. I'm part of this beautiful world of women who have been through this, who have done this through history, and I'm now one of them. And I think, and it actually gives me goosebumps. This is why I fucking love being a doula. But it is so powerful.
I love that you're saying that. Yeah.
But
because that's why I created this podcast, because I want more women in that rite of passage, in birth, in careers, I mean, we both have careers. We're both moms, feeling empowered, creating something great. Like, I know also in your food development work, you develop great products, like, as women, we are so capable and so able to do so much.
Yeah.
But
you can't, I just know that, women kind of, they have their baby and they just kind of get forgotten by their friends who either don't have babies or, they're just getting on with their lives. And, we're really quick to congratulate each other when, when I've launched a new product. All of my friends will be like, oh, well done, that's amazing, love the product. But, we should be saying, oh my God, you made a fucking baby, you're a fucking superstar. Like, be cheerleaders for each other and like talk about it, talk about how positive or negative or whatever it is, but talk about it and make it normal to talk about childbirth as something transformative, I think.
And do you think, I mean, I wanted to wrap up, but I want to have another question about this, but do you think there is this kind of negativity attached to it because it's such a huge setback to careers usually, or to the way normally, well, men don't have this setback, but the way normally you progress in life, right? Then it's seen as a setback by society, having children.
I think it completely depends on what line of work or your employer. I've been very lucky to work at places and currently work at a place where it is like not encouraged to go and have babies, like go, but it's not seen as a negative for your career. It is seen as something like that can be honored and supported, and ultimately modern society is not set up for women to have both, but certain companies make it easier for women to have both. So I think it does depend on the company a lot. Yeah.
Good. That's good to know that. How can we bring more trust, intuition, and empowerment back to women? I mean, more competent, that would be a great starting point. Yeah.
It's hard to say this without sounding like a complete hippie, because it does sound hippie when you look at it through the medical lens or like modern culture, but make home birth the default so that we start to trust in our bodies again and start to trust that this is something that is very normal. Teach physiology. Don't make it be that only people who are doulas or buy these books understand this. Like, this should be stuff we're taught in biology at school, like Key Stage 3.
Or at least like RC class.
Yeah. Let it be the norm for women to be women and be primal if they need to be primal. Don't like stop women from expressing themselves however they need to in whatever walks of life, so that when they go into labour, they're like, oh no, I need to be really quiet. Oh no, I don't want to upset anyone. Like, just let women trust their bodies and be who they are and share positive birth stories, I'd say, rather than, oh my God, it was a fucking nightmare. So yeah, there's a lot of things that you can do, but basically let women realize how frigging powerful and magical they are, because they're amazing.
Yeah, and we can remind women that, throughout the pregnancy and even throughout their life, hopefully, and that will equip them. I feel like because I given birth so young, I haven't met yet reality, telling me that I'm unable to. And then in the last 10 years, this happened, and now I have this doubt. So definitely just remind women how amazing they are every day.
100%. You're going to smash this.
Last 3 quick-fire questions.
Yes.
No thinking.
Okay. Oh, God.
One myth about childbirth you want to debunk for good.
That it's linear. That your waters will break, you will go into labour, then you will progress, then this will happen, then that will happen. Just bollocks. My waters broke a week before I went into labour. It's like,
really?
Yeah, nothing will happen. It may not happen linearly. It is not a bad thing. Your body can be in pre-labour for 2 or 3 weeks. Braxton Hicks are not fake contractions. That is your body preparing. Everything is your own timeline, your own path. So that is a big myth that I want to debunk.
One thing you'd say to a woman who feels scared of giving birth?
I once did a fear of flying course. This is completely like irrelevant, but I did a fear of flying course with Virgin Atlantic because I hated flying. And you get into this room with loads of other people who are all terrified of flying, and you sit down on a table and they say to you, what are you scared about? Like, what bit of flying are you scared about? And you hear what everyone's scared about, and then they explain to you why the thing that you're scared about is bollocks. So I would say to a woman who's scared of giving birth, I would want to know what they are scared of, like what the element is and what power I feel that I can help her find within herself to rethink about it and reframe that fear as, let's think about that fear as adrenaline in a way, but there is always a way around it.
Yeah. What kind of birth do you dream of supporting more women through?
I mean, one where all 5 Spice Girls are there with me, like that would be really cool. I think I actually wrote down an answer to this question, and I'm ignoring it because I don't think that is the right answer for me. The kind of birth I dream of supporting women through is one where they find their power and they say afterwards, oh my God, that was like that. I was allowed to be myself and I felt everything through that. And like, I believe you, I'm magic. That for me is incredible. And that's the power that every single woman has and should have.
I know exactly what you feel, because after my birth, I felt like there is nothing I can do,
Yeah.
There is like, I felt all the feelings.
Yeah.
Like, I was like, I've done this, I can do anything.
Yeah, it would take you to like, there's that moment of transition, which will take you to the point where you're like, I'm going to die. Like, my body can't do this. I'm splitting in half. And to come out the other side and you'd be like, okay, I've basically danced with death and I'm here and I have a baby. There
was
that's
definitely
magic.
a moment and where I said, I cannot do it. It's impossible.
Everyone does it.
It's impossible. She was like, it's coming, just a few more. And then I actually rewatched the video like the other day of me giving birth because I filmed it. And then when I said, I cannot do it, and then I did it, they're like 4 minutes in
Yeah,
between.
they
so
will
it's
be.
really a fraction of time.
It's a great way for midwives and doulas to know that the end is close. It's a trick, but it's when your body finishes kind of going through the liminal stage of like being in labour land, you get a rush of adrenaline because the contractions will start changing to pushing contractions. And that adrenaline snaps you out of being in labour land and brings you back into, oh my God, what the fuck I'm doing? Like when you get woken up like really suddenly from a dream, and you're like, whoa,
that's
whoa, whoa,
pretty much what I
happening?
said.
Yeah, it's amazing.
Well, incredible. As I said, I will film after this talk how it's gonna go in September. Let's see if I'm gonna travel to Laborland or it might be C-section or God knows what it's gonna be. I think I'm coming open-minded to this, but I hope that I will say it was incredible again. So
yeah. It will be.
Yeah. If I was in the UK, I would call you to come with me. But
yeah, it's a bit of a trek to Brazil, and I'm scared of flying, obviously. So
obviously, thank you so much. It was so great.
Thank you. That was really, really lovely, and thank you so much for having me. I appreciate it.
If you found this episode helpful, share it with someone preparing for birth or someone who might one day. You can follow Catherine at Nourish and Bloom Doula. And I'll see you next time on Do Not Disturb, the Inside Story. Bye!